Okay, good morning everyone. There's probably a couple more people yet to join, but we'll make a start. It's gone 1:30. So welcome to our event, Places of Worship, COVID Secure webinar. This is another of our series of webinars aimed at supporting businesses and organisations with information as we follow the government roadmap out of lockdown. While places of worship have been able to remain open, some have operated solely online via streaming, while many faith group leaders will have questions about how to adapt as more people seek to return to life as normal and we follow the announced dates around the roadmap. Hence, we're hosting this recorded event today to help with information and answer any questions you may have. Delighted to see so many of you on the call today. We'll provide, in terms of format, we'll provide a brief current COVID-19 picture for Warwickshire, advice around places of worship, information on risk assessments and what help is available, and also talk about lateral flow testing and contact tracing. The webinar is brought to you by safety and regulatory colleagues from local borough, district and county councils and Warwickshire Police Fire and Rescue Service. Many thanks to all of our partners who have helped us today to plan and promote the webinar today. Please note that this event is being recorded, so should you remain logged in, we take this as your consent to take part. The information provided today is current and correct to the best of our knowledge on the 25th of March 2021, so please note this if you're viewing the webinar at a later date. The format today will be for our panel to introduce themselves. We'll then cover the key messages I mentioned, and then we'll open up to pre-submitted questions and also any questions from those on the call today. You can raise your hand at any time or submit a question via the chat. So my name is Ian Flynn and I work at Warwickshire County Council and I will be your facilitator today. So I'd like now to introduce our panel, starting with Paul.
Good morning everybody, my name is Sergeant Paul Calver from Warwickshire Police. I work within the COVID cell within Warwickshire Police and I've been working around COVID with all our partner agencies for about the last 12 months, so have quite a bit of experience of all different sorts of issues that you might raise today. Thank you.
Thanks Paul. Emily?
Thanks Ian, and hello everyone. I'm Emily van Deventer, Associate Director of Public Health with Warwickshire County Council, here to give you a bit of an overview of the current situation today and then obviously support with any questions you have.
Thank you. Henry?
Hi, Henry Piddington, Principal Environmental Health Officer for Commercial Regulation Team at Rugby Borough Council. I've been involved with our joint regulators group across the county since, well, for about a year now, and happy to give advice around risk assessments and how you can make things COVID secure. Thank you.
Thanks, Henry. And finally, Jonathan, are you on the call?
Good morning, everybody. I'm Jonathan Toy. I'm the Group Manager for Warwickshire Trading Standards and Community Safety, and I have been chairing the twice weekly regulatory meeting with all of the districts and boroughs, public health, police, Warwickshire Fire and Rescue since the original regulations came in. Today is actually our 1-year anniversary of when those meetings first started. It seemed quite a long year, I have to say, and I'm sure many of you will agree it has as well, but it's nice to see so many familiar faces who've joined us on previous webinars today, so it's good to see you all.
Okay, thanks, Jonathan. So, Emily, would you be able to give us an overview of the current situation in Warwickshire? And
I've got a couple of slides just to share, so I'm going to try and share my screen now, Ian.
Okay.
Hopefully this works. I can't see people, so if you can just let me know, Ian, if you're now seeing my screen.
I can see that. We can see that. Yeah, thank you.
Brilliant, thank you. So this is the pattern of COVID infections that we've had since the beginning of, since the end of March, split by district and borough. So we've got a dotted blue line, which gives the Warwickshire figure overall, and then pink for North Warwickshire, blue for Nuneaton and Bedworth, green for Rugby, black for Stratford, and orange for Warwick. You can see broadly we've had this great downward trend. If I just zoom in, for the last 3 weeks, we have seen a bit of an uptick in some areas. So Stratford has had a slight increase, Rugby a bit more pronounced in recent days. Overall, we're at 66 per 100,000 population for Warwickshire, and I'm pleased to say that all of our districts and boroughs are beneath the 100 per 100,000 mark, which for me is always a key figure, particularly when you're thinking about events, because if you have 1,000 people together, when you've got 100 per 100,000 as your COVID infection rate, incidence rate, then you are likely to have at least one person present in that group of 1,000. So I think that's a useful number to keep in mind. We think, well, broadly, the increase that we've seen in some areas has been linked to schools and workplace outbreaks. And of course, when you have cases within a family or a household, you've got that interplay really between schools and workplaces. Both of those settings are doing a lot more in terms of the rapid testing now. So we saw a bit of an increase as schools started implementing that, but the idea is that we will be picking up infections much earlier through having that regular testing in place, and then obviously getting on top of it and breaking those chains of transmission. So we're watching this closely in terms of what happens and the advice that we would subsequently give around events, etc. But at the moment, although, as I say, we've had a bit of an increase, I'm not overly concerned because it does largely correlate with the increase in testing. I then just wanted to show this chart. So we've got two here. This is the top one is over all time, and the bottom one is a picture of the last 3 weeks. So you've got 10-year age bands at the side, and then daily numbers effectively. So where of infections. So where you've got darker colours, it's a higher number of infections. So you can see over time, it's primarily been this working age population that's had the highest incidence and had the most transmission. You can see the older people there. There's some white gaps, which is great to see, so no cases. So we are seeing cases in the older population coming down quite nicely, not completely eliminated, but seeing benefits of the vaccination programme there, certainly. And then if you look at the bottom line, so the last 3 weeks, it's just a clearer picture there. You can see the kind of school age population coming out there, as well as then links potentially to parental ages and the workplace settings having an influence there. So that was the key data I wanted to show for you today, just to give you a sense of where we're at currently. So it's overall positive, but watching it with a little bit of caution in terms of what happens over the next couple of weeks, and then obviously as various sectors open up more widely. So in terms of thinking about places of worship, we feel we're obviously in a better position now. It's really important, though, that even if people have had their vaccine, that people don't relax and really do maintain all of those key prevention measures. So that's maintaining your 2-metre social distancing, wearing face coverings indoors, using hand sanitizer. So thinking about the flow of people coming into your settings. Where are those key locations that you need to put hand sanitizer? Making sure you've got a one-way system through the setting, and then, yeah, as I say about the hand sanitizer, kind of on entry to toilets and any other key points that may be relevant to your venue. Obviously, we need to ensure that people don't come to a place of worship if they have symptoms of COVID, or they should be isolating for any other reason, be they a close contact or recent travel abroad, for example. In addition, we've been increasingly learning the importance of ventilation, good ventilation, to avoid that build-up of aerosols within a particular space. So that relates both to making sure you've got appropriate capacity limits. So thinking about how many people you can have in your space, maintaining social distancing, and minimising the amount of time really that people are spending in an indoor setting together. So keeping services as short as possible, which obviously all of that helps to reduce the amount of aerosol being expired and building up in a venue. And then the ventilation, as I say, really key in terms of keeping fresh air coming in and that old air going out. We're also in a better position, as I say, with the testing within schools and workplaces, and actually anybody now can access a rapid lateral flow test. So that's a test which will give you a result within about half an hour. We've got 6 community sites across Warwickshire where people can book in and access those tests. And if they are parents or in a support bubble of school pupils, then they can pick up a collection, a supply of home kits as well from those sites. So I would really encourage you to talk to your congregation about all of those things, making sure they're not coming if they've got symptoms or if they've had contact with anybody with symptoms, encouraging them to undertake a rapid test within the community before any service, before the congregation comes together. And actually not just as a one-off, but if you encourage them to get that in as a regular habit, ideally rapid tests should be taken 3 to 4 days apart. So the rapid tests are very good at picking up when you're infectious. So when you've got a high viral load and potentially spreading that, but they are effective for a shorter window than the traditional PCR swabs. So the swabs that take at least 24 hours to get the results back, which go off to the lab. So that's why if you're doing them every 3 to 4 days, then actually much more likely to pick up any change in terms of when you become infectious. A few other points I wanted to just highlight as well. One, obviously there is government guidance available for places of worship. So just Google coronavirus places of worship and you'll see that come up. And that talks about all of these things that I'm mentioning, including avoiding sharing items, avoiding kind of handshaking, and really just being really clear on your cleanliness routines and frequencies and making sure high contact touch points are cleaned frequently. But also really importantly for us is that you have a system in place that can support us with contact tracing should you have a service and we later identify that somebody has attended who has developed coronavirus. So really that's, we've got the QR codes. You could scan the QR codes if people are using the apps to have those on your door. And if that's not available for you, or in fact actually having both available, so you've got a mechanism of recording who's coming to the venue that day, so that if we do need to get any messages out, we can do that really promptly, working alongside you and support with that contact tracing. So those were the key bits of public health I wanted to give at this stage. I've touched on lateral flow testing and contact tracing as well, but haven't yet spoken about risk assessments. So really important that you undertake risk assessments for your venues. There are templates available on the HSE website, Health and Safety Executive website. But I recognise that it's a bit tailored probably for your settings. You may require some tailored advice. So we have got Henry on the call today who can talk a little bit more about how to undertake a risk assessment, what needs to be in there. But we do also have a coronavirus prevention and response team who can support you in undertaking these risk assessments and offer further advice as well. So we will share contact details for them.
Yeah, Emily, it's probably key that I would have thought that most or all venues by now would have done some form of risk assessment. So perhaps what's key now is updating those. And if any of our colleagues on the call from the faith community, that they may have questions about how to adapt what they have already. So it would be good for us to share those details. Would that be by telephone or by email?
Probably best is by email to preventandresponse@warwickshire.gov.uk. Okay. As you say, keeping those documents live and updated is really important, and particularly with the Kent variant, which is more transmissible through aerosols. We have been encouraging all the businesses that we work with to update them in light of that potential increase in airborne spread.
Yeah, we'll post those links at the end of this on the recording, which will be available shortly for everyone to share. Henry, did you want to come in at all on risk assessment? I see we have a hand, but I'll just hold that hand for a moment. Henry, if you wanted to comment.
I think, as you say, and I think probably most of the people on the call have probably experienced and been writing these COVID risk assessments since the last year, and since we first reopened up our places. I'm probably used to doing risk assessments anyway, but yeah, it's just a case of making sure they are up to date and reviewed and take into account some of the new variants, as Emily said. So I don't think I've got anything else to add, but happy to advise if anybody has any specific questions.
Thanks, Henry. Emily, did you have anything further to add?
I just want to comment about singing. I don't know if I'll do that now or I can come on to that a little later. If I perhaps just pause and let people ask questions around the risk assessments for the time being.
Yeah, there was a hand up. I think it was Jerry. Did you want to come in now, or have we answered your question?
Yes, yes, it was just about singing. And oddly enough, all the advice, all the government advice on websites is all from last year. And I found it ever so hard to get stuff that is current to this reopening of places of worship. So yes, I just wondered about singing.
Yeah, happy to take that. So we've had a discussion amongst public health consultants within Warwickshire, and we're comfortable to give the line that please continue to avoid singing indoors. But if you are singing outdoors and can maintain at least 2 metre social distancing, then we're comfortable with singing taking place. I think we recognise actually there's a really important healing element to singing, and particularly communal singing. So we want to enable it to happen in a safe way. So that's based on both the guidance for places of worship, but also the guidance that was issued for performing arts. So if you can just have one person singing, then you should look to do that. But if you do feel that congregational singing, communal singing is an important part of your service, then please look to do that outdoors. And as I say, at least 2 metre social distancing for that.
Okay, thank you.
Thank you. Jonathan?
Thanks, Ian. The only thing I would add to Emily's comments on singing is, as you know from the different step changes, there are different elements that take place from the 29th of March and then the 12th of April and hopefully the 17th of May, depending on, as Emily says, if the rates vary or if we're going in the same direction. If they're going in the same direction, those dates hopefully will enable more things to happen, and there are less restrictions as those things come into place. 17th of May, I think, is quite an important date because 17th of May is the date where indoor theatre, cinema, that type of activity can take place. And I would genuinely hope, and I'm sure Emily would agree, that as we get close to that date, and if things are continuing the direction they currently are, which is very positive for our county, we would be in a situation where we would be talking to you about reintroducing singing, perhaps the use of choirs, etc. And that might be a date to start thinking about bringing those things back into place. That would be my recommendation to you. And we can always keep you notified through the different chats and the blogs that we do to tell you about where we're going and the direction we're going in, to keep so that you're fully updated on that progress. I hope that will be helpful.
Thanks, Jonathan. We've got a few hands up and we've got some question in chat, but I'll go, if that's okay, to Neil. Do you want to ask your question?
Specific to Salvation Army, but it links to singing. Brass instruments. Do we take the same stand there, or are they worse, or whatever? I know that last year, sort of during the autumn, winter, before the uptick, we were able to take 6 out socially distanced, and we went outside people's homes and things. What's the prediction for that?
Jonathan, I think you put your hand back up.
Yeah, it's my favourite subject, and as I shared before, my daughter is actually a brass player. She can't wait to get back out and entertaining people. Their plans at the moment are very similar to what Emily has said. If they're doing outside events, that's what they're planning for. So they're going to do some prep work, and I think come the middle of April, they'll start doing more outdoor type of activity and outdoor events. and then coming the 17th of May, smaller, slightly more restricted numbers within either the ensemble or the group that they're playing within. They're going to make sure they maintain 2 meters social distancing during that period that they're playing, but they're very much looking forward to bringing that back in on the 17th of May as well. But outdoor, they are planning from the 12th of April. So again, if you kind of follow that same line, that would be my strongest advice to you. But if I hear any more, or my daughter is telling me off a lot about the lack of brass playing, I will definitely let you all know, I promise you.
And I would support that, Jonathan, as you say, outdoors, kind of up to 6 at the moment, just small groups, and potentially thinking about if you're playing to an audience, having perhaps 3 meters between the band and the audience, so just extending that slightly as well.
Just a question there in chat: is there any written guidance re singing outside? And I suppose the same for brass instruments.
Well, as I say, it's a mixture of between the performing arts guidance and the places of worship guidance. They both got a few lines in there, so I'll pop some links for those in the chat for you. Fantastic.
Okay, thank you. This might not be your name. I appreciate that people have sometimes different names on their showing on their computer because they borrowed somebody else's kit in the family. But is it Frederick McDonald? Might need to unmute yourself.
Sorry about that. Could I ask 2 questions? The lateral flow testing, there was some question about the reliability of these tests, and have they improved then while you are using them? That's the first thing. And I did want to hear a little bit about the risk assessment, even though you kind of dismissed it, that everybody has done that. It would be very helpful to get a bit of that information. So because you were suggesting that everything continued almost as before until the 17th of May, we would be looking at that. But I would still like to hear a little bit about the risk assessment. Thank you.
Okay, thank you.
Thank you. So we're happy to take the part about the lateral flow, the rapid tests. So in terms of their reliability, they are better at identifying negatives. So if you've got a negative result from an LFT, it's about 98% likelihood to be correct. There's a higher risk of identifying false positives, which in a sense, in terms of controlling spread of infectious diseases, isn't a bad thing. There are ethical issues around isolating people if they haven't actually got COVID. But the other thing is that the accuracy of the test does depend on the level of the virus that's circulating in a population. So if you've got a higher incidence at the time, they will be better at picking the infections up. So that's why whilst incidence was high, we said we could go by an LFT, and if you have a positive LFT, then actually you would still self-isolate. As rates are coming back down again, we are expecting to see the reintroduction of the PCR tests in terms of having to have that second test. So if you like, the LFT is like a screening test, and then the PCR for a confirmatory diagnosis, and then isolating at that point. I don't think we've quite switched to that yet, but it's likely to come soon. In addition, how they are done is really important. So the risk with the home testing kits is that if they are done not very well, then there could be increased risk of false results. So what we are encouraging people to do is come to one of our community test sites where they will supervise you to take a test, so you can get used to how it's done. And then, as I say, at the moment, parents or support bubbles, households of school pupils can take home kits back with them. But as I say, if you've been through it a few times, so you're comfortable with how to do them properly, then actually it should be a relatively reliable test. So at the moment, if you take an LFT at a test site or another kind of controlled environment, then you don't necessarily have to go for the confirmatory PCR at this stage. What you do need to do, if you do them at home, there is a requirement to go for a confirmatory PCR.
Thank you.
I hope that helps.
Yes, thank you.
Thank you.
Okay. In terms of the risk assessment, Henry?
Oh yeah, apologies, Frederick. I didn't mean to gloss over that section. Yeah, so with regards to the risk assessment, so if we look at how we look at doing a risk assessment, obviously, as Emily says, there are templates available on the HSE website, and we will offer advice. So what you need to do when you're carrying out your risk assessments is to look at the processes of what happens at your place of worship. So you need to go through each step of that, and then look at what the risks are of the transmission of COVID at that step. And then the final part of that is how you mitigate those risks. So for instance, you know, you're looking at how people are, say, sat down whilst they're having a service. So you'd look at then the number of people you can fit into the premise, the service safely, so they can safely socially distance. You know, and then you look at each stage, so people going into the place of worship. So again, your mitigation is you make sure people are socially distancing, face coverings are worn, you got sanitizer points for contacts. Is my network quality bad? Sorry, can you hear me?
We can hear Henry.
Yes, yes, I can.
Hello.
Yes, I can hear you.
Sorry. Yeah, so apologies. I can't hear you very well. So as long as you can hear me, that's the main thing. Okay, yeah. So yeah, so the risk assessment looks at the areas where there may be risk of transmission, and then we look at how you mitigate those risks. And the risk assessment basically sets all of that out. So it's a sort of 3 stage. You look at where the risks are at each stage of the process, and then you look at how you can mitigate those risks so that they become an acceptable risk, I suppose. If that makes sense. Does that help, Frederick?
Yes, thank you.
Jonathan?
Yeah, I'll add a little bit to what Henry said, Frederick, and hopefully this helps. If Henry and I went along to do a risk assessment of your building, we're looking at how the building operates and how it operates with the people and the use that you're applying to it. That's our first thing. And the next thing we do is we walk through the building and we would walk through it on the basis of how that building operates in each of its stages, along with the people that are coming into that building. And we'll do that walkthrough. And the 4 things we'll always be looking at are the things that Emily talked about. How do you maintain social distancing? How do you ensure that hygiene is maintained, particularly where you've got pinch points? So it might be the entrance, it might be in toilets, it might be, you might have certain locations a bit more restricted than others. We look at things like ventilation, and we look at things, and we look at use of PPE, face coverings, etc. And how do each of those stages, we'll look at each of those different elements. And then what we'll try and do is we'll try and work with someone in terms of planning the use of that building for the more intense periods that they might want to use it. So we might look at things like, do you have a separate exit that you have from an entrance that would then actually maintain the flow of people in a certain area? If you have, say, a number of worships or events going on a certain day, do you have the time between them to allow people to move away, allow one part of the service to end and another service to begin? So they're the things we would talk through, we would look at. So you've got plenty of space, there's not lots of people commingling, trying to be in the same space at the same time. That's the elements we look at, those 4 things. We would walk through the building, and then we'd look at how you're planning the day, depending on those events. That's what we're regularly talking with places of worship about. So if you follow that very simple process, every single risk assessment document you'll pick up, we would go through exactly the same process. That's what we would do.
Thank you. And preaching, though, one other question. Preaching, you know that Pentecostals tend to preach and they kind of raise the voices and things like that. They've got to avoid that, haven't they?
I think again, it's all about keeping the social distancing on those. You know, when Emily was talking about moving to 3 meters, if you've got someone who you know who's a very vibrant speaker, and you know, the congregation is very much is receptive to that, because they're expecting it. Think about having them 3 meters plus distance. Yeah.
They don't have to have a shield.
You're making it sound incredibly dangerous stuff all of a sudden. I'm getting quite worried about what's going on. Social distancing is for us is the biggest thing. The more we can do on social distancing, the greater opportunity we have of preventing the spread. We've had lots of debates about screens and things and other elements, but you know, as Emily has said, ventilation and social distancing are absolutely at the heart of this.
Gotcha. Yeah. Thank you.
Okay, thank you. And Paul?
Yeah, can I just make a plea? And I can't believe I'm actually saying this on the places of worship, because I would normally say it for hospitality, pubs and clubs. But when you're looking at those risk assessments, can you also look at your sort of dispersal at the end of the congregation and when it takes place? Obviously, different areas might have bigger congregations as such, but please do bear that in mind, because obviously from a police perspective, we do get complaints about absolutely everything when it comes to COVID, and it would make no difference if it was a place of worship or a pub or a night or whatever it may be. If people think people are breaching the rules and congregating in groups larger than the regulations at that time allow, they will call the police. So please, can I just make a plea that when you look at your risk assessments, please take that into account, how people disperse from the premises at the end of the congregation or the worship that's taking place, so people do disperse effectively. It's probably the best word I can use, and don't gather in groups and talk about what's they've just been at as such. That's all I would plead. Thank you.
Okay, thank you. Thanks, Frederick. So looking over to who else has a hand up, Sue Field.
Hello, I'm the Archdeacon Pastor in the Diocese of Coventry, and just to say that, as my understanding is that the Places of Worship Task Force, which includes various people from the Church of England, is about to report with some guidance on singing particularly, and that will then filter into the Church of England specific guidance. I'm just slightly anxious about giving permission to sing outside until we've had that official guidance, because it might well affect our insurance. So I think, as far as I know, we're waiting for that. Our bishop seems to think it might come next week, which I know is very near to Easter, but I think we're just waiting for that to happen.
Okay, thank you for that, Sue. Anyone on the panel want to comment on that at all?
Just to say, I mean, I'm relatively comfortable with giving that advice around making sure it's outdoors and 2 metre social distancing if it is to take place as a communal activity. But as you say, so you're absolutely right to also check with your own organisational guidance, who will all be producing their own stuff. So yeah, do look for that, particularly as you say, if it has insurance implications.
Thank you. Thanks, Sue. Rina Sana.
Hi. Yeah, I was just raising the thing, sort of a comment about I have experience of like Sikh places of worship and Hindu places of worship, and I know that when we have any sort of congregational celebrations or religious events, there is food served afterwards, and even if there isn't food served, there is an offering, and it may well be another place of worship too. There is an offering that's given from hand to the person. Like, it could be fruit, it could be we call it brochard, it could be like a semolina type of dessert. So I don't know whether there's any guidance around that for places of worship.
So I mean, my advice would initially be to avoid having items that you'll be handing out to people. It comes into that kind of sharing of items. We've had discussions with local mosques recently about Ramadan. There's a tradition around breaking the fast of sharing dates and water. So we've encouraged people to bring their own, and you can share with your own household, but avoid sharing beyond that.
Thanks, Emily. There's actually a question in chat about communion as well. So that's a similar question to what Rena's raised, really.
Yeah, so yeah, happy to take that. It is mentioned in the places of worship guidance around how to do a safer communion. So it is allowed to give out the body of Christ. The guidance is to obviously ensure whoever is giving that has thoroughly washed or sanitized their hands both before and after, and to only place it in the hand. They shouldn't be placing it directly into anybody's mouth, and when they're placing it in the hand, to try to avoid any direct skin-to-skin contact. If that is made, again, then to sanitize again before going to the next person.
Thank you. Rena, have we answered your question, or did you want to follow up?
Yes, it's answered. I mean, I'm assuming there shouldn't really be food, is from what you're saying, and that's what I thought. But I know that it is out there, you know, like I know the lungers are going on, so long as I guess they're keeping social distance and all the sanitizing is done. But yeah, I just thought perhaps, you know, something about risk assessments in all of that should be included if any of those organisations do approach yourselves, so that they do it safely.
That's really helpful. And, you know, if we look at workplace settings where they've got canteens, it's absolutely about avoiding self-service. So you haven't got shared spoons, for example, that everyone's touching. So there are safer ways to do it, but I think the safest is to avoid at this stage.
Yeah.
And Ghazala, your comments question is relevant here as well. Did you want to mention that?
Sorry, I was just muting myself. I'm having a bit of network issues. Yeah, just following on from what Rena was mentioning earlier on. If a risk assessment was conducted, and maybe if the prashad was put into food bags pre-hand and handed out, would that be something that they could consider?
So pre-packed.
Yeah, and then you have one person actually. Yeah, because I've actually been to temples and I kind of know what happens. It's usually a big bowl where somebody uses their hands to take out some of the prashad and then hand it out to people's hands. But if it was pre-packed, would that be something that could be considered?
I mean, that would certainly be safer than having, as you say, people kind of putting hands in bowls. So if you can have, yeah, pre-packed food and make sure hands are sanitized before giving them out regularly. So yeah, again, it all depends on your individual venue's risk assessment and what is absolutely integral to your ceremonies.
Yeah, thank you.
Thank you.
Thank you. Okay, we'll move on. Kim Smith.
All right. Won't unmute.
Yes, we can hear you now.
Can you? Thank you. It's still telling me my microphone's muted. Okay, don't trust everything you read. Good morning, all. I'm church warden at Waterhoughton Parish Church. I wanted to ask a couple of questions, but before that, if I may add a comment from our experience. I mean, we've kept the church open as much as possible with what we felt were very thorough, very rigorous risk assessments. To the stage we felt very confident in what we're doing. But my advice, if I may, to anyone who's not very familiar with risk assessments is when you think you've got it absolutely to perfection, you think you're perfect, sit at the back of church and watch what people do. And I guarantee you will pick up something that none of you had thought about. And even one or two of our parishioners watching on Zoom have contacted me later and said, do you realise I saw so-and-so doing such and such? So be ready to listen and modify as you go. So I just add that in. Couple of questions, if I may. Good Friday is approaching. We traditionally have had a walk of witness through the village carrying a cross. We wondered whether that would be permissible if I realise it is difficult to encourage people to distance within that walk of witness, but we'd very much like to do it if we think we can encourage them to keep apart. And the other one, if we can't do the walk of witness, can we gather in the churchyard, preferably with singing? It's obviously easier to encourage people to maintain their distancing, but hopefully they won't still have to wear masks if they're outside in the churchyard. So I'd appreciate any comment on that, please. Thank you.
Be thinking on that one now. I think it's okay. I will ask for colleagues to comment as well, but if you are outdoors, obviously we shouldn't have people mixing between households with more than one other person outdoors at the moment. But if this is considered part of a service, it may be permissible. It's probably slightly in that grey area at the moment. Whether you do it as a walk, as you can see, Henry and Jonathan are keen to come in. I think whether it's done as a walk or within the grounds of the church, the key thing really is that social distancing is maintained.
Thank you.
Thanks, Emily. Henry?
Hi, yeah, just sort of on the, I guess, the technicalities of that. So from the 29th of March, there will be an outdoor exemption. So Good Friday, I believe, is the Friday following that 29th of March. Is that correct? Yeah. Okay, so there is an exemption then for having 6 people to gather outdoors. From the point of view of the walk, again, it's difficult because if you have more of them than that number and you encourage people to gather in bigger numbers, then obviously there is potential breach of the regulations. Potentially you could have a small group do the walk of 6, but then it's how you then make sure that the spectators or the people walking along don't sort of breach those social distancing rules, and you're almost sort of into a gathering situation. So I think it would be quite difficult to manage, but I also think that you need to look at how you'd risk assess it and how you'd marshal it and how you'd manage it. And I think Jonathan might want to come in and give some more advice regarding that. So I'll leave that. That's my thoughts on the regulations anyway. And with regards to the churchyard, again, that would probably formulate a part of the place of worship. So again, you could then have a slightly larger social distance gathering as you would normally within church, and follow Emily's advice regarding singing, etc. That makes sense. I'll let Jonathan come in because I'm sure he's going to want to comment on that as well.
Thanks, Henry. Kim, how many would you normally have on that event?
Maybe 30 or 40 people, depending on the weather and the mood at the time. Maybe fewer because people are still very, very hesitant about getting together. But I am right in thinking that even under this rule of 6, people still, if they're not in the same household, still need to keep their 2-meter distance from any other bunch of 6. I've heard so many people say, oh, well, as long as we're in a group of 6, we can hug each other. So no, you can't. You've got to keep 2-meter distance.
That's so right.
To my mind, if it's 40 people, if each sort of separate household group is still 2 meters or more apart within that walk, I sort of puzzle to see why that would be any different from total strangers walking along the footpath.
Yeah, I think we probably need to just have a meeting with you and kind of talk through that with you. I mean, Henry's right in terms of trying to keep the numbers to a minimum. That would, I think, would be my starting point. I know, Kim, you and I have had similar conversations on remembrance events, haven't we, previously in a similar way. So I think my initial bit would be the same approach. Is how can you minimise the numbers? Yeah. And are there ways that you could perhaps stage people coming at different times on that? So actually we did similar things, didn't we, back in November, that you might have a smaller procession, but then you might have other people coming along at a different time doing a similar walk in a different way, and you publicise the route that you're going on and you stagger it so that actually you either keep people in bubbles or keep people in the numbers. So I think there's ways to plan it. I would be less worried about the outdoor singing, as long as, again, you keep people apart you know, keep people a good 2 meters distance. We know it's less risky. I think I would just be cautious of numbers. That we could have a conversation with you, Kim, outside of this and see what we could plan. I think for everybody on the line here, and we've had the same conversation with imams and mosque committee leaders. We know we really want to try and help people celebrate the events that are coming up and be really positive. You know, I think it's a time, isn't it, where we really want to try and get things back to some degree of normality, and social contacting and our places of worship are absolutely vital within this. So we would love to have conversations with you about enabling things to happen rather than saying why they can't happen. I think that's the kind of mood shift we're finding ourselves in. So Kim, give us a call through, and we're happy to talk you through with that.
Okay.
And if I can just comment, I think really sensible advice from Jonathan there, just to take the point about maybe no different than 30 strangers walking down the street that happen to be kind of shopping at the same time. I think it is different because people are there for a common purpose and probably know each other within that mix of people. So there is increased risk of social gatherings.
Okay. Thank you very much.
Yeah, thank you. Okay. Thank you, Kim. So we still got a few questions outstanding and conscious of time. So Minnie Lee, did you want to come in here?
Thank you. Yes. You mentioned before about allowing time for people to exit the building if there were more than one service going on. We've agreed to allow one of our churches to be used by one of the other branches of our religion, the Roman Catholics, as opposed to the Anglican Church. They are going to have a service, but how much time do we then need to leave before the Anglicans move into that building?
I don't think we can give a definitive number because it depends on the size of the venue, the numbers of people coming, but it is about having time for everybody from the previous service to exit, time to wipe down and disinfect key touch points prior to the next lot coming in.
Okay. The other question I had was, what do we do about toilets? We have a largely elderly population within our church, but we also have some very young children. How do we manage the toilet situation?
Yeah, it's really important. You know, we have to have them open for people for obvious reasons. We've got some guidance around safe opening and use of toilets, which we can share with you. Key measures really are about managing the numbers of people in at any one time. I'd say opening windows if you can, so again you're improving ventilation, having hand sanitizer on the way into toilets so people use it, and signs to prompt people to use it, and then on exiting it's about hand washing with soap and water. Best is to have paper towels, disposable towels, and then a pedal bin, so a foot operated bin with a lid that people can then dispose of, and trying to keep, well, making sure toilets are on your kind of regular cleaning schedule and making sure the bins aren't overflowing with those paper towels. I think that covers the key bits.
Thank you, that's really helpful.
Thanks, Minnie. Your hand's not up, Liz Hicks, but I know you submitted a question before the call, and you've got a question in chat. So did you want to put those questions now yourself?
Hello, yes, that would be really helpful, thank you. So just a couple of questions. At the moment, under the current restrictions, we're only allowed a certain type of activities in our places of worship, and the guidance is very specific as to what those restrictions are. So at what point will those kind of restrictions start to lift so we can hold further events? So for example, we're allowed to hold a service as part of our worship, but we're not allowed to hold a meeting of people to discuss a specific event or to hold a training event, for example. So at what point do you think that sort of restriction will be lifted and we can start to open back up to some of the other activities.
Henry, I think your hand went up first.
Hi, Liz. Yeah, I saw your question submitted earlier, and I was just before the webinar started. I had a quick look through the regulations. So you're quite right. There is specific exemptions for you to allow communal worship within the places of worship, and that restriction appears to remain in place in the legislation, that exemption, until the potential 17th of May date. So my feeling is that it will be the 17th of May when other activities can start to resume indoors, because that's when indoor activity, gatherings and indoor hospitality and everything else is going to start reopening. So that will be my feeling, will be that you would need to aim towards that 17th of May date.
That's really helpful. Thank you.
Jonathan?
I think Henry's probably answered it for me. 17th of May. That absolutely. I'm with Henry 100%. I've gone through the regs as well. I completely agree with Henry. There are some venues that are trying to run training events as a way to open up their communal facilities. We've been slightly concerned about the number of requests we've had for training events, which actually aren't training events. So I would absolutely say to you, plan for the 17th of May. That would be really good. Can I just quickly answer Minnie's other question about time period that you look for? Can I just give it in a again fairly simple? Give yourself at least half an hour. At least half an hour. That's what we've tended to find. Our experience is if you get less than half an hour, what happens is people arrive early and people stay later, and that's when you get that mixture and that larger congregation. And if you are giving yourself a minimum of half an hour, tell the people who are about to arrive that they can't arrive before that half an hour. Okay. Yeah, that's, to me, that will be the absolute minimum.
Yeah, that does make it a lot clearer. We're quite concerned about it because I think there was a bit of misinformation in the first place before these services were arranged. So we're trying to get it so that at least we can make some form of cleaning preparations, if you like.
Yeah, at least half an hour. Tell people arriving they can't arrive before that half an hour.
Thank you very much. Thanks. It's helpful to hear this because it's confusing trying to sort out what we can do when.
Okay, thank you. Alan Smith.
Hi, just well, a question and a comment on different matters. The question is the United Reformed Church advice includes, but in our reviewing risk assessments, we should take into account the variants that are in the local area. So is there somewhere we can find out what the current strains being seen in Warwickshire are? And it's obviously it impacts on how we see the effectiveness of vaccination as part of the mitigation. And then the comment on communion, Emily dealt with the bread but not the wine.
Oh, yes.
My understanding is that those of us in traditions where we use individual cups have a slight advantage here in that we can use hygienic methods of preparation to distribute those, but would be interested in your comments on that.
If I take that latter point first, certainly no sharing of cups, please. So yeah, if there are ways you can have individual cups, then yes, wine could be given out, but certainly no sharing of the same cups. In terms of the new variants, we can share links to some Public Health England reports for you. What I would say for Warwickshire, and actually UK-wide now, is the Kent variant is the dominant strain. I think it's about 90% of cases, so that is the more transmissible version, and hence that is what happens. A more transmissible version is going to become dominant. We haven't had any variants of concern in Warwickshire as yet, so those are the kind of the known, particularly the South African variant, Brazilian variants, ones we're keeping a close eye on. They're not far away. You know, we've had the South African variant within a few neighbouring areas, so we've got plans in place if we do need to kick off some targeted testing around following identification of any of those variants, but at the moment they're not. So it is very much just thinking about that B117, which I always think sounds like a flight number, but the Kent variant and that airborne transmission risk that brings.
Thanks.
Yeah, okay. Alan, did we answer your question? Was there anything else?
That's yeah, if we can have those the links to the reports, thanks.
If we don't have them now, but you'll certainly be on the recording that will be available on the Warwickshire County Council YouTube channel in a couple of days. Okay, thank you. Barry Jackson.
Thank you. I've just put my questions in the chat as well. So just really, I came in partway. I'm having problems logging in, so I've come in partway through. And apologies if I've missed answers to some of this already. You mentioned someone was going on about a walk of witness. We do a cross-country walk around Good Friday. Group of us each year tend to do it. Didn't do it last year, obviously. We were thinking under the outdoor sports being allowed type stuff that would be acceptable as an organised event, as a charity organising, not an individual. So we could do risk assessments, we can plan it, we can organise it so that there's no mingling between groups of 6, ensure that there's social distancing and enforce that throughout the process. Are we right in interpreting that legally as saying we can walk between the churchyards across 6.5 miles, 4 different churches, pause in each churchyard for a short reflective service? Would that be a correct interpretation of what's allowed after the 29th of March?
I think similar to a question asked earlier around walks for Good Friday, I think it does very much depend on that individual risk assessment, and we can discuss that with you as a follow-up from this webinar. So if Henry wants to add anything to that. Henry, did you want to offer any advice?
Yeah, sure. I was just thinking if Jonathan wanted to. Yeah, thanks, Emily. I was just thinking of Jonathan. I mean, I would be quite reluctant to deem it organised sport, and there is quite a definition of organised sport in that it needs to have an official governing body of that organising sport. And of course, I appreciate, you know, there is a governing body to your organisation. I'm not sure it fits under that sport, organised sport. And whilst I wouldn't want to say you can't do it, I just think it may be not quite fitting into that definition. However, I think, you know, if you look at how you want to do it, there is, you know, there probably is a way of doing it. And as you say, if you sort of set the groups off sort of well spread out, and they keep within that limited 6, as long as, again, if they're in the same household, obviously they can be as long if they're in groups of 6 from different households, and again they still need to socially distance anyway. And I think, again, that's risk assessment. And if you did that and you made sure there's a decent amount of spacing between each group, then it's possibly something that, you know, you could look at doing. I'm going to see what Jonathan says. Thank you.
Barry, you can tell as regulators, we regularly have these kind of conversations, and thank you for posing this one. I think probably my view is perhaps have a conversation with you, as you know, outside of this, and see how we can help you. The first thing I'd say to you is avoid calling it an event, as well as avoid calling it a sporting activity as well. Events have a very specific category, and if we were being asked to plan on an event, there is a date somewhere in the future that we would be looking for an event, and I think what you're talking about is probably not less of an event. It's more of an activity. Not enthusiastically when I'm saying this, because it's really important. Yes, good, excellent. And then I think we can have a conversation about how we can help you, how we can enable it. I also made your note about outdoor singing, and Sue raised that as well earlier. And there will be guidance that will come out. As Emily said, we're less worried about outdoor singing as long as people keep a good social distance and numbers are kept to a minimum. That would always be our advice. the new variants and the transmission of the variants are very airborne, and they last in a very small aerosol droplets over a longer distance. But in an outdoor space, they disperse a lot quicker. So again, with a bit of planning with you, I wouldn't be too adverse. Again, it depends on numbers and that planning. So perhaps we can have a chat outside, Barry, on your non-event activity.
On our activity, sorry, I misworded it. Thank you.
You're on mute, Ian.
Thank you. I'm conscious of the time, and I'm not sure if our panel are able to remain on the call for much longer. There are still some hands up. You can submit any further questions to business@warwickshire.gov.uk. That's business@warwickshire.gov.uk, and we'll forward them on to the right people in the team to provide a response. Panel, did you want to remain on, or do we need to bring this to a close?
Sorry, and if I could just come in, sorry, because I'm going to have to leave very shortly. But just from my perspective, and especially with the follow up to the sort of the last question as well, the regulations as they come out are not always clear, as I'm sure everybody that's on this call will probably appreciate. We've worked through them for the last 12 months, and they're still not, as clear as they should be. And there are variations of interpretations of them as well. So all I would say is, as a result of this webinar, is anything that you're thinking of doing that you are not sure whether you can or can't, then please do get in touch via the links that Ian's going to share later, because we can advise. We are, as regulators, authorities, whatever you want to call us, are desperate for everybody to return to some form of normality. And we do really, value places of worship as that support network for the community. It has been missed by a lot of people, no matter what the faith, what the religion, it's been missed by a lot of people. And there's a lot of mental health issues that have cropped up around COVID, where these organisations can help lonely and vulnerable people as well. So we are desperate to help you and get places open and help you with the worships that you want to do as such. But if you're not sure, then please do ask via those links, because a misinterpretation of that regulation can lead to problems for everybody as such, and we would like to help you through that before it arises. That's all I really wanted to say, because I'm going to have to leave very shortly, but just want to thank everybody for joining, because it's a great turnout as well. Thank you.
Thanks, Paul.
How do we get access to the recording?
So that the recording, Frederick, if you send your email address to business@warwickshire.gov.uk, we'll forward you the link. But if for any other reason, you can also find it on the YouTube page for Warwickshire County Council.
Thank you very much.
It'll be there. You'll have to search for it, but it'll be there. There are still a couple of hands up. One of which was Rena.
Yeah, thank you. Sorry, it will just be a quick one. I read earlier in the chat that I think Jonathan said that Jonathan and somebody else, Henry, I think, are willing to help with risk assessments. Now, I work in Bedworth with communities and organisations, and I have a number of Bedworth ministers on a mailing list. Would you be okay if I was to send, if they wanted to have risk assessments, to be able to share your details with them, so that they can get in touch if they want help with risk assessments? Because I was looking to send them the links just as a follow-up from this. I think there's one or two that are on the call, but not. I didn't recognise many names.
Rena, can I take that bit of a burden off of Henry? If you email the prevent and response at warwickshire.gov.uk, I know Louisa will put that into the chat.
Okay.
That's our central team. Ghazala's actually part of our central team. She's on the call now.
Yeah.
And if we needed to, and we could arrange to give some direct advice through the central team. They're doing risk assessments all the time. So very happy to help, Rena.
Okay, that's lovely. Thank you.
Thanks very much. And there was a question in chat from Claire Edwards about testing, but Emily, have you dealt with that with your comment about testing?
I don't think I have on that one. I missed that.
It was
about temperature checks, Emily, and I think you have just responded to that. Sorry.
Yeah.
Okay. I think you've dealt with. Okay. Okay. There is a question here that was pre-submitted from Mark Adams at the Church of St Mary's, but I think we'll respond by email on that one because it's quite a long one. Were there any final comments or questions?
If I can, oh, sorry, I'll let Barry go.
Barry.
Sorry, I don't mean to go. It was just you mentioned earlier on about getting in touch to have a further conversation. That's popped it in the chat. Just don't know how I do that. Just
if you want to get in touch, if you send an email to business@warwickshire.gov.uk and just briefly explain why, we can forward it on to the right people.
Okay, brilliant. Thank you. Thanks very much.
And I just wanted to finish really with a reminder to people that the key risk for COVID transmission that we are now seeing is that prolonged period of time in an indoor space, and particularly if ventilation is poor. So anything you can do to kind of minimise time spent indoors and minimise numbers of people is gratefully received really by us, and I'm sure by your communities too.
Thank you, Emily. So perhaps with that, we'll end for today. Thank you very much panel for your time, and for all of those on the call for joining us today. I hope that's been useful. Recording will be available on the YouTube channel for Warwickshire County Council. It'll take a couple of days to get posted, so bear with us. If you want that link sent to you, if you email business@warwickshire.gov.uk, we can send it on. And yes, the best of luck with your faith activities over the coming weeks and months. Thank you all.
Thank you, everybody.
Thank you.